Hi everyone. Let me ask you a question that many men are secretly searching on Google, but rarely discussing openly. Why am I waking up 2 to 3 times every night to pee? If you are over 40 and this sounds familiar, you are not alone. This condition is known as nocturia. And while it may seem like a small nuisance, it often is a big warning sign from your body. In fact, a recent meta-analysis in the Journal of Urology found out that up to 69% of men over 40 years of age experience nocturia and most do not know why. So, why it happens? Many assume it's just the bladder or the prostate acting up. But nocturia is not just a urology issue, it is a multi-system signal. Let's simplify it. There are mainly three reasons why men wake up at night to urinate. Your prostate might be enlarged, it squeezes the urethra, leading to incomplete emptying of the bladder, and your bladder never fully empties, so the cycle continues. It is here the twist. Only 33% of the cases nocturia are actually due to the prostate. In the remaining 67% of the cases, there is something else. Your body is producing too much urine at night. That is known as nocturnal polyuria. It can happen because of high salt intake, undiagnosed diabetes, heart failure, and sometimes simple drinking too much of the fluid after 8 p.m. Recent research in the urology and urodynamics shows that 60% of the nocturia cases are linked to excessive nighttime urine production and not the bladder itself. Your sleep is disturbed before your bladder is. Yes, this is surprising. Many men think that they wake up because they have to urinate, but in reality, they wake up for other reasons like sleep apnea. Only then they notice that the bladder is creating a problem. In patients with obstructive sleep apnea, the body releases a hormone known as ANP, which signals the kidney to dump more of the fluid. This means that even urine if your bladder was not full. So what keep you up? It might be the urge, it might be the oxygen. Why should you care? Because nocturia is not just annoying, it is medically important. Men with nocturia have almost 2 times higher risk of the fall and fracture, increased cardiovascular risk, poor sleep leading to memory loss, fatigue, and even depression. In fact, according to the study in the Journal of Clinical Sleep Medicine, men with nocturia are more likely to have an undiagnosed sleep apnea, diabetes, heart dysfunctions, all masquerading as a small bladder syndrome. So, what is the fix? So, start with at least this 3-step checklist. Track your fluid intake. Are you drinking tea, coffee, or alcohol in the evening? That's a common trigger. Keep a bladder diary for at least 3 nights. Write down what time you urinate, how much you urinate. If you are passing more than 33% of your daily urine output at night, this is probably a nocturnal polyuria. Now get yourself evaluated, not just by urologist. You might need a prostate ultrasound, urine osmolarity test, sleep study, and a simple blood test for the sodium, sugar, and BNP. Treatment today are not one size fit all. We are using some of the prostate related medicine, desmopressin for polyuria, CPAP for sleep apnea, even afternoon diuretics to shift the fluid early in the day, and when needed, minimally invasive surgeries for the prostate enlargement if at all it is required, and if at all it appears to be the culprit, and it works wonders in selected number of patients. So nocturia is not a normal aging. If your body weighing a red flag, often long before bigger problems appear. If you are waking up more than one night to urinate, don't ignore it. Get evaluated. Treat the cause, not the symptoms. Thank you.